Ghana is poised to make primary healthcare more accessible across the country. Building on the gains of the Mahama Cares initiative, government is preparing to roll out a nationwide free primary healthcare program in early April 2026. The program is designed to bring essential healthcare services closer to communities, ensuring the Ghanaians with valid NHIS cards can access basic medical care without paying at the point of service.
It's our expectation that we roll it out as early as possible. We shouldn't go beyond the first week of April. You don't need to necessarily pay anything to access at least a primary health care. All you need is to identify yourself as a Ghanaian. When you have a very strong national health insurance scheme, what it does is that after the free primary health care, that's a primary level, the national health insurance will also help you to assess healthcare be above the primary healthcare level. So primary healthcare, strong national health insurance policy. Now, as part of the preventive measures, you go back to the free primary healthcare, early screening, early detection, sensitization, preventive measures, promotion. That is where our community health nurses at the church compound will be moving to the farms, they'll be moving to the mosque, to the churches to sensitize the people on the do's and the don'ts, on our information centers in our villages, on our local radio stations, national televisions. So these are all part of the package of the policies we are trying to roll out to have a very strong and a robust health sector in the country. Again, if you are saying free primary health care, we all know that, our primary health care facilities are challenged. So there's a need for retooling. Government is doing that. We want to retool our health facilities to be able to deliver better services to us.
The Health Minister, Kwabena Mintah Kando, says stakeholder consultations are currently underway ahead of cabinet and parliamentary approval. He explains that the program will be supported by the construction of additional CHIPS compounds, enhanced public education in local languages, and the deployment of digital health systems, including artificial intelligence, to improve service delivery.
Now the policy framework is ready, and once the policy framework is ready, in order to take everybody along, we are doing series of stakeholders consultations so that everybody will be taken along. And so we've met a number of stakeholders. We are going further. We are going to engage Parliament even before we start rolling out. What you may not know is the fact that to roll onto the National Health Insurance Scheme is by compulsion, it's compulsory, by law. Everybody is supposed to enroll onto the National Health Insurance Scheme. That is the law, that's the position of the law.
With the free primary healthcare program set to take off in April, authorities say Ghanaians can expect improved access to essential health services and a reduction in out-of-pocket healthcare costs, an important milestone in the country's push towards universal health coverage. Martha Boache and Deborah Beidus reports, read to you.